We are live.
Yes, sir.
Good evening and welcome to the inaugural Lymphoma Summit by IHW Council in association with AstraZeneca. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, India's premier institution for health awareness, advocacy, and behavior change. We all have enough fear of cancers, but we lack adequate awareness about the causes, prevention, and timely care of this disease that kills over 8.5 lakh Indians annually and affects many more families and lives. So almost any part of our body can develop cancer. It can also grow in the blood. And this type of cancer becomes more fearsome as the awareness about them is even sparse. And therefore, this month of September is observed as the Blood Cancer Awareness Month globally. Lymphoma is a type of blood cancer, and today is World Lymphoma Awareness Day. This disease grows in the lymphatic system, which is responsible for supporting the blood circulation mechanism and also our body's immune function. Doctors estimate that about 54% of the blood cancers that occur every year are lymphoma. As per the Globocan 2020 report, India registered 45,049 new lymphoma cases and 23,903 people died because of it. And what is important to note is that lymphoma is also one of the most prevalent cancers among children. And this scenario is also global. Some studies put the estimated incidences of lymphoma in Indian children between 15 to 20%. At IHW Council, we believe knowledge is power. And by knowing the risk and warning signs of this disease called lymphoma, we will be able to strengthen this battle against cancer together and help save more lives. And to know more about the present realities related to the prevalence of lymphoma, ways to prevent it, detect it early, and understand the emerging treatments and how it can be available to everyone who needs it, we have a galaxy of esteemed medical experts and public health advocates today with us in this unique program. So let me welcome Dr. Sandeep Shah, medical oncologist and hematologist and transplant physician, co-founder of Hemato-Oncology Clinic, Vedanta. We are also joined by Dr. Rahul Bhargava, Director and Head of Hematology, Hemato-Oncology and Bone Marrow Transplant, Fortis Memorial Research Institute of Blood Disorders, Gurgaon, and Dr. Sharad Damodar, Vice Chairman, Oncology Services, Clinical Director of MSMC, Senior Consultant and Head of Adult Hematology and BMT at Mazumdar Shaw Medical Center, Narayana Health City in Bangalore. And we are joined by Dr. Bhau Saheb Bagal, Professor, Consultant Medical Oncologist and BMT Physician at the prestigious Tata Memorial Hospital in Mumbai. So welcome all our esteemed panelists today. We are also going to be joined by a lymphoma survivor and fighter very soon, and we will also try to hear some stories from him about how he defeated this disease. So let me begin with Dr. Sandeep Shah. Dr. Shah, if I can ask you to kind of help us explain in simpler term what lymphoma is and what are the causes of lymphoma before we go to maybe more technical aspects.
Basically, we have blood cells, white cells, red cells, platelets, and white cells are mainly granulocytes and lymphocytes. So basically, lymphoma is a cancer of these lymphocytes, which are in the blood, and they are also present in the other organs like liver, spleen, and lymph nodes. So lymphoma is when you tell liquid malignancy, they are leukemias, but solid malignancy of blood cells are lymphomas. And usually they present with lymph nodes enlargement and some blood changes, liver, spleen enlargement, and they can also occur to some other organs also. As I said, that lymphocytes are present in all of organs of our body. So I think that we will discuss later. They are known as extramedullary lymphoma, but basically lymphoma is one type of blood cancer, and it's a enlargement of lymph nodes, and it can involve all other systems also.
Thank you so much, Dr. Shah. So I think in a simple term, it is a blood cancer, and it can involve, it occurs in the lymphatic system and can occur anywhere in the body, I think, because lymph nodes are all across the body. Let me ask Dr. Bhargava. Dr. Bhargava, what is the epidemiological realities related to lymphoma in our country, and what is the burden of this disease which we are facing? Sir, you are on mute, Dr. Bhargava.
Okay.
Yeah.
So Kamal, to put the things into perspective, let's not call lymphoma a cancer. Put it that lymphoma is only lymphoma. Why? Because the moment you call it a cancer or a blood cancer, the stigma of non-curability, expensive treatment, and the death sentence starts lingering with lymphoma. And nothing is true with lymphoma, because majority of people are surviving longer. If you see the burden, this is the third largest problem in the country. Okay, and it can affect any blood group, any age group. It can affect males are affected more than females. Just can be because of the bias itself. But yes, it's one of the realities that is one of the third largest problem in the country, lymphomas, and that too Hodgkin's and non-Hodgkin's lymphoma. If you divide the demographic, can say the younger people are getting affected with Hodgkin's as low as age of 3 years or 4 years, and as we are living longer, to 90 years of age, majority of people are affecting or are living till that age are also suffering from lymphoma. So there's no age barrier at what age lymphoma will not affect you. It can affect at any point of time. And the burden is ever increasing. And the people who are living with lymphomas are also increasing. So the death rate with lymphomas are coming down. As we know, in females, the breast cancer has become number one after beating the cervical cancer because of longevity and better hygiene and so on and so forth. And so many various demographic things. So far, the lymphoma is the demographics are stable. Every year by year, with the longevity of life, we are living longer, and the number of lymphoma patients are increasing, and so are the lymphoma survivors. So let's put this: lymphoma is lymphoma. Lymphoma is not blood cancer. It does not have any stigmas of blood cancer. You are surely going to win if you have lymphoma, because you are aware disease spectrum can be treated with various newer medications, and together you and me and rest of the doctors are there who will make sure that you live with lymphoma forever.
Thank you so much, Dr. Bhargav. I think actually it helps in putting the things in perspective. However, from the layman point of view, we understood that way. But I think your point is very right. And let me then, since you have mentioned about that, when it comes to cancer, a lot of that stigma start coming in. And also the whole fear of cancer being a death sentence. So before I go to Dr. Bhau Sahib, let me go to Mr. Basu, who is a cancer fighter, as lymphoma fighter for that matter, and also a survivor. Mr. Basu, can you hear me?
Yeah, I can hear you properly.
Yeah, thank you so much. I can understand that you will not be, opening your video, and I, respect that.
Yeah.
So, what would be more important for our audience today to understand the story of the hope, and also that what Dr. Rahul has just mentioned, that many times when diseases like lymphoma or maybe other type of cancers occur, it kind of brings a very, very different experience, a different kind of uncertainty in front of people. You
True.
have lived those moments, if I can say, those also dreadful moments.
Yeah,
Let
yeah.
me just kind of hear a little bit of a story from you, that when this disease was diagnosed, what were the symptoms?
Yeah, I'll tell you. So to begin with, I just completely agree with what Mr. Bhargava said, that if you call lymphoma just lymphoma and don't, group it with cancer, then it'll be the stigma attached to the word cancer is much higher. So if you just call it lymphoma, then things easier to digest, even for the patient and his family. So it all happened. I started losing a lot of weight. And initially, I thought that probably I'm eating less and working hard, and that's the reason. But after a few months, I started noticing some prominent lymph nodes on my neck area. And then I realized this cannot just be a malnutrition. This is something else. Then I saw a doctor, and the doctor suggested a small biopsy kind of a thing. And I went through that biopsy, and I don't want to name the hospital, but one of the most prominent hospital in Calcutta. They actually diagnosed this as a non-Hodgkin's lymphoma. But my doctor, Dr. Pranta Chakrabarti, he actually suggested me to get this test done again. I mean, like, he asked me to collect the slides of that biopsy and get that test done from a different lab. So when I went to the different lab, they said it's a classical case of Hodgkin's lymphoma. Now, as far as my knowledge is concerned, the treatment for Hodgkin's and non-Hodgkin's are completely different. And Hodgkin's is probably slightly easier to handle as far as medical terms are concerned. And I'm not very sure about this, but my initial diagnostics was not correct. It was said, I was told that it's non-Hodgkin's, and then later on it was Hodgkin's. So that is there. So when the moment we learned that it's a kind of cancer, it's a kind of blood cancer, obviously we were shattered, scared, and everything else. But then we had a long discussion with our doctor, Dr. Pranta Chakravarti, and he actually explained the whole thing, that what exactly is lymphoma. Although we call it cancer, but it's not that kind of a rare cancer, and it's quite manageable with new treatment and all. Then I started, going through the treatment and everything. Now I'm like doing well and doing perfectly all right. So that's my story.
But so what is your age?
I am 42 right now.
42. And when this disease was diagnosed?
It was diagnosed when I was 37, I guess. 36 or 37.
Oh, 36. So how long was the treatment? And normally, I think it's a quite an early age for anything of this sort happening.
Yeah.
And I can understand that what kind of trauma you might have undergone, or the family might have undergone, when
Yes.
the first kind of relevance might have happened.
Yeah.
So how long the treatment lasts?
So the treatment was for around 8 cycles of chemotherapy. And that's this chemotherapy. I just want to talk to, say a few things about this chemotherapy. The chemotherapy actually, restricts you in the house. I mean, because of the infection, because of the low, this thing, you cannot go out, you cannot work, and all these problems are attached to it. But I've heard that there are some newer medicines which are called immuno. Like the doctors can be, in immunotherapies. That doesn't reduce your count that way. I mean, like, probably you can do a little bit of work outside also with the immunotherapies. So my treatment was around 8 to 9 months long. And during that time, I was like completely under house arrest because of the low count and everything. So that was there. But immunotherapy or the newer medicines, which is non-toxic medicines, will actually, I mean, like do better in this kind of a treatment. That is my belief. So that people can, lead, I mean, like they can work, they can earn money, they can go to office and stuff like that. Yeah. So that is there.
Yeah, that is, I think that is important. Uh,
Yeah.
how is your life now in terms of you are going work to the work?
Yeah. Right now
Everything is normalized. Nothing
it's
is.
normalized. Yeah, it's normalized, and I've heard that there's no specific precaution that you can take after Hodgkin's lymphoma. I mean, like general, I mean, like precautions that anybody can take. I mean, like during COVID and other times, that is fine. But there is no diet restrictions. There are no otherwise. You just have to lead a healthy life. That's it. That is my brief. So if that in that way, so my life is normal right now. I'm traveling, I'm working, I'm doing everything else. So
Normally, such kind of stories are very, very important because for many others who get the similar kind of experience
right.
of trauma, uncertainty. Hearing people like you who have gone through that, but have kind of been able to manage it properly and are back to
Right.
the healthy life. It's definitely a lot of inspiration and helps a lot to the other patients, also empowers the other people as
Yeah.
well. But thank you so much. You came on this show and you shared your story. But it would have been even greater if you would have kind of spoken with your face on as well on camera.
So I'll tell you, I also want to mention why I don't want to show my face, because I am into a professional service, right? And the word cancer or malignancy, all these things, there's a lot of stigma attached to it, right? A lot of people, when they meet me, they will meet me as a cancer survivor. Now, my problem is when you are doing well and you are completely fit and you're like leading a regular life, I don't want anyone to see me in a sympathetic view, right? I mean, like, if I'm okay, right? I'm just like anyone else.
Yes.
So I don't want to become a cancer survivor and attract a lot of sympathy from people. That doesn't help in the, in a professional world. Yeah. So that's why
that's a very, very, I think, important point. It's not only professional, but I think even for a
anywhere else
team, you don't want to be, kind of stigmatized or maybe bracketed for certain thing and then, get that kind of.
Yeah, I mean, like you can have any disease, right? You can have a fever or you can have food poisoning or whatever.
Yep.
So during that time, when you're suffering from that disease, and once you're recovered, when you are leading a normal life, then why attract a lot of sympathy from people? So these days, cancer survivors is like the new term. But my thing is, once you have survived this, and if you are normal, then don't talk about it. I mean, you can talk about it, but yeah, don't attract any sympathy.
Thank you so much. I think very, very important point, and I really respect this, Mr. Basu, and I believe that you are doing wonderful in your life now, and it's absolutely, since you have come out of it, there is no need to be, kind of still remain attached to that. It's just a phase gone, and the life is normal.
Exactly.
And
exactly.
As usual. Thank you so much. We'll talk to some doctors also. Please stay with us, and we will like to hear more later on from you.
Sure.
Dr. Bhau Saheb, Mr. Basu talked about some of the symptoms which he kind of saw initially, and which was a weight loss, I think majorly, and then he also noticed some lymph node kind of abnormality or the enlarged size. What are the what are the other symptoms normally, and how people can actually prevent or detect lymphoma, or is it preventable also?
Yeah. So first of all, thank you, Mr. Narayanan, for inviting and giving me opportunity to talk. And I really want to thank Mr. Basu for sharing his experience. I'm glad to join my colleagues, and Dr. Shah is a very senior oncologist, and my friend Dr. Rahul. And I'm also glad that Mrs. Vandana is with us. So I will start by explaining the symptoms of lymphoma. As Mr. Basu said, fever without any reason, or having a weight loss without any reason, that is unintentional weight loss, or having a excessive night sweat, these are called as B symptoms, where you have no reason for this kind of um, uh, symptom. So this can be one sign of a symptom of lymphoma. Another common symptom of lymphoma is, since these are the cells derived from the lymphocytes, which normally reside in lymph nodes. So enlargement of lymph nodes, or these are kind of glands in your neck or axilla or groin, can be a symptom of lymphoma. Next thing is, these lymphocytes stay in your bone marrow, and they may cause some issues with normal bone marrow function. So you may have low WBC count, or you may have low hemoglobin, or you may have low platelet count, and because of that you may have fatigue. So if your hemoglobin is low, you will feel easily tired, or you will feel breathless when you are walking. If your platelet count is low, then there is a chance that you may have a easy bruising, or you might bleed on small trivial trauma as well. And another in sign could be repeated infections, or immunity goes down because of lymphoma. So these are common symptoms of lymphoma. So it is important that these symptoms are looked with the proper perspective. If you look at the symptoms, they are very common. If you have a viral infection, you will have all of these symptoms. So usually these symptoms, if they persist beyond few weeks and there is no other reason, so it is best to consult a doctor if you have these symptoms, and if especially they are lasting beyond few weeks, and then an appropriate test should be done to confirm this diagnosis or rule out this diagnosis. Coming to prevention, so as Shah said, there are really no good causes for disease, and if you don't know why this disease happened, then there are very little ways to prevent. But the one thing I can tell you is, this disease sometimes tend to occur when your immunity is low. For example, you are on immunosuppressive medicines, or you undergone a, for example, kidney transplant, or people with immunodeficiencies like HIV and AIDS, their immunity is low. So it is important that they are treated appropriately, so that their immunity is good, that they don't come to cause immunodeficiency state, and that is one way to prevent it. But largely, as compared to other cancers where, for example, smoking is a cause or alcohol is a cause, there are no typical causes like that. So probably the role of prevention is in this kind of lymphomas is not much.
Thank you so much, Dr. Bhau Sahib. I think you have very well explained the symptoms, and I think everyone should watch out for these symptoms. If they are persisting, they should definitely kind of consult the right doctor, so that I think in this case, more than prevention, timely detection and timely care is the most important aspect, and that can happen only when people are more kind of aware about the body, the changes which it is undergoing, and also any kind of these symptoms. So Dr. Shah, what are the treatments of lymphoma? If somebody has already identified it, what are
Hello.
major treatments? Mr. Basu said that he underwent almost 8 cycles of chemotherapy, but he is also mentioning about some of the new therapies available, which may not restrict people in that way, or may not have that kind of, if we can say, side effects. So what are the treatments available, and how they are kind of emerging, the new treatments are coming into the picture?
As far as we see the treatment of lymphoma, basically lymphoma is of two types: primary non-Hodgkin's lymphoma and Hodgkin's lymphoma. I think those patients who need treatment, some of the lymphomas they don't need treatment, and they can be kept under observation for few months to few years, and they progress very slowly, and early treatment doesn't help them. So, but those patients who need treatment, I think for lymphoma, chemotherapy is the basic treatment, and most of the patient will need chemotherapy, and some patients may need local radiotherapy. And some patients, high-grade lymphoma or very aggressive lymphoma or lymphoma who relapse after early chemotherapy, they will have to also undergo bone marrow transplant also. And immunotherapy is like antibodies. We may say the lymphoma which we use immunotherapy is antibody to CD20, which is rituximab. But in most of the lymphoma, it is not used as a single agent, but it is used with chemotherapy only. So chemotherapy is the basic treatment for most of the lymphoma. Some lymphoma may need very aggressive chemotherapy, and some lymphoma may need just single agent rituximab or just local radiotherapy. So it depends on the which type of lymphoma it is.
Thank you, Dr. Shah. Dr. Bhargava, would you like to add on this? What are the emerging treatment modalities? And again, I would like to hear from you also that how much of the new treatments, advanced treatments, immunotherapy, targeted therapies, are they also helping in effective management of lymphoma, and especially when the disease comes at age like Mr. Basu got it. It's a time when you are also supposed to pursue your professional activities. You have to be maybe in an important stage of your career, and a treatment which may kind of restrict you completely in house, or may make you kind of cut off from the mainstream work in society, can also have additional mental trauma associated with it. Dr. Bhargav.
So Kamal, on the lighter side, we like Mr. Basu, we always keep on telling people like Mr. Basu to go to the offices to earn money so that they can spend in hospitals. Okay, we never restrict them at home, because lymphoma treatment by and large does not suppress your immunity to such an extent that you will get infections. But yes, when you have Alexa, when you have got Zoom, when you have got plenty of YouTubes and you have Paytms of this world, why on earth do we feel that the chemotherapy will not be smarter, sophisticated, simpler, and more surer? What makes you think? What people think is the moment you have lymphoma or you hear a word cancer, you get directly transported to 1990s. You think that chemotherapy is like a pan bomb, which is going to kill everybody, good, bad, ugly, and going to leave you much worse. No, you are in 2021. So first, most important thing in lymphoma, what determines your chemotherapy is your name of the disease. Whether it is Kamal, whether it is Bahu Sahab, whether it's Rahul Bhargav, good, bad, or ugly, what kind of a chemotherapy which you're going to require depends upon to the name of the disease, because every disease has got a different chemotherapy protocol. Because we understand the diseases, we know how they have originated, how they need to be killed. That is why that's called the personalized therapy. Second important thing, how much you require. Is Kamal requires 12 cycles, Rahul requires 12 cycles, Mr. Basu requires 4 cycles. Who decides that? It is not that one fine day I will say, oh, Mr. Kamal, you will require 12 cycles. And next day my wife has given me breakfast. I'll say, no, we'll fix it at 4. It's not that way. So there's a staging. There's a proper process of staging. In Hodgkin's lymphoma, you can get away with 2 cycles chemotherapy plus radiotherapy if you are stage 1. While you will get 6 into 2, 12 times chemotherapy if you are a stage 4 chemotherapy. And newer modalities, because we know that people, we need to take it to 100% survival. The immunotherapies or targeted therapies, what is called brentuximab, nivolumab, they are coming into the fray of those people who we predict that they're not going to respond to the conventional chemotherapies. Those are the people who get these newer chemotherapies. Otherwise, old is good, old is gold is all. We talk about these chemotherapies. What has transpired in this much time is a better supportive care, better antiemetics, better therapies which can prevent your nausea, vomiting. They can prevent nausea, diarrheas. They will not make you feel worse. So, Mr. Basu, people who are suffering from Hodgkin's lymphoma, They come on Friday afternoon, take chemotherapies, rest on Saturday, Sunday, and they're back on their work on Monday. Some hair fall, yes, there will be hair fall. And he has raised a very valid and relevant point that we don't require sympathy, neither we require empathy. Please leave us. There was a problem. We have solved a problem, and let's move on. Neither there's a sympathy which is required. Any cancer survivor, why do we say survivor? We are all survivors of something or the other. Either we are survivors of the air pollution, we are survivors of COVID. Do we call Kamal and us a COVID survivor?
Yeah. COVID also had that stigma initially.
So I think the most important thing, Kamal, is the staging has to be very sure. The disease biology and the disease name has to be sure. As Mr. Basu has raised a very relevant point. I keep on sending my slides to Bahusab. He's a very dear friend. Whenever in doubt, we send it to him because as cumulatively, as combined modality, as across the boundaries of the hospital, we work to get the right disease diagnosis. And very, very important thing, don't be ever afraid of biopsies. My dear friends, whosoever is listening, you diagnose lymphomas not by putting your hand onto it or by imaging. You diagnose lymphomas by doing more biopsies and ISCs, immunohistochemistries. That is the way to give you the right diagnosis. So right path, if you pick up, right treatment you get, you are sure that in 2021, you are going to get cured for sure.
Thank you, Dr. Bhargava. And I think the important aspect you have highlighted that lymphoma care or any other care has to be much more personalized, and then there are much more personalized treatment modalities available which can help patients recover faster and also without much of the side effects which we normally associate, which we carry forward the same impression from past. And I think medical science is growing so fast that every year or maybe every 6 months, there may be a much different way of treating something. Let me go to Ms. Urvashi Prasad is also with us. She is from Niti Ayog. And Urvashi ji, since you are a public health advocate also, and one of the point which Mr. Basu, who is I would not say now the lymphoma survivor, he had lymphoma, he is now out of it and he is back to his normal life. But what thing he mentioned that many times people start stigmatizing because of somebody having cancer, or start showing a lot of sympathy, which many times may not be something which can put the person who has gone through that and is out of it into the right frame of mind. You also is a very important health communicator as well. How do you see this whole scenario? Because the cancer, if I see say as a whole, we are seeing a lot of that, almost 13 lakh cases happening in India every year. I think every family or extended family or somebody knows somebody having cancer. How we normalize the discourse around cancer and make it something that, okay, this is going to happen because as we live longer, as we and there are a lot of multiple factors which are beyond your control. One is this lymphoma, which is I always feel that, okay, every disease should be preventable, but Dr. Bhaus have just said that it is not something which you can prevent because the cause is not known. So getting lymphoma may not be something that, okay, you intentionally indulge into something and you got that, and that is why stigma and all that. It is a disease which can occur. How do we normalize these discourse that, okay, people start feeling that, okay, if it was a cancer or if it was a lymphoma, it's all right. You gone through, you are healthy, and that's it.
Yes. So, firstly, I think it's great that Mr. Basu shared his personal experience, and I think so many things that he said resonated with me, and because I see it all the time in my work, and even around me, where people have been dealing with this condition. And I think stigma is something that we deal at a much bigger level in public health. One sees it all the time. Pretty much any illness, any disease that we pick up, whether it is tuberculosis, whether it's now COVID, whether it is a mental health issue, pretty much everything is stigmatized. So I think cancer, of course, at perhaps another level altogether. And I think the reasons for that are several. It's also something that a lot of people still think is a death sentence, or people think that, you really cannot ever get back to sort of your life as you would like it to be. And of course, yes, in many cases, unfortunately, in our country, it is detected very, very late. And for a lot of people, unfortunately, we are not able to save either their quality of life or even their life itself. But I think the whole idea that it is something which is at the end of the day a disease, right? It's an illness, and it should be seen for what it is. It should not be made into something much bigger and larger. And whether it is sympathy or whether it is something where we hold it against the person that it's your lifestyle which has caused this, or it's your fault. We really clearly need to move away from all of this. And I think this, of course, needs a much broader societal effort. I'm usually quite sort of vocal in areas where I feel the government has been lacking. And I think the government certainly, and when I say government, I mean governments, of all these years, governments at all levels need to do a lot more to address these issues, which are public health related, which are social stigma related. But it does need a broader set of stakeholders to be working on this, simply because it is such a broad and such a big issue that any one ministry, department, or government even cannot tackle it on its own. So I think that is on the stigma part. But I think in general on lymphoma from, or any cancer really, from the policy perspective, there is a lot we need to do on the public health side to get the awareness, the symptoms, the common symptoms as we know them, to raise awareness about these things, especially including in our smaller urban centers, in our villages, in our towns. India doesn't just live in its large metros, of course. So we need to make sure these messages are reaching, right to the last mile. And there's huge gaps in that currently. And I think that's something we are acutely aware of. And that's why we're bringing in initiatives like the health and wellness centers to try and address that. But there's still a long way to go before we can actually really operationalize it fully on the ground. So I think making people aware, of what this disease is, what are the early symptoms, how can they take action, what action can they take. I think that is something we need to do. On the other end, on the treatment side, we also need to constantly see how we can actually get access to the latest treatments, to the best treatments for our entire population. And of course, there it's an issue of financial access. It's also an issue of access to the actual facilities. And that is where, of course, we've made a start with something like Ayushman Bharat. But we need to constantly see that in the insurance component, are we really covering adequately? Are we covering the latest treatments? Because as I said, again, we cannot restrict them to only a section of our population. Ultimately, they should be available for everybody. And how do we address the whole actual access to healthcare? Because just having an insurance, but if you still need to come from your village or from your town to a major urban center to get treated, as a lot of people still do, then again, that is suboptimal. So how do we take this treatment? How do we take this care to people close to where they are? That is also something that from the policy side, we really need to look at. So I think there's multiple pieces. I think some of them, the government clearly has a bigger role to play in partnership, of course, with private players. I don't think it can be done without that. But I think underlying all of this are the stigma aspects, the societal aspects, which I think a whole range of stakeholders need to come together and really address and take very seriously. Because there should be no need for people to, say that we don't want to come forward or we don't want to show our face. I think that is a very shameful thing for us as a society if that is happening. So we do need to take that seriously and we need to address that.
Thank you so much, Urvashi ji. I think you have covered both of my aspects. One is that the communication aspect of it and the awareness, because I think in all these diseases and the awareness plays a very, very important role. And I think the whole, the challenge which we face as a country of late detection of cancers or, diseases like lymphoma, which ultimately leads to more loss of life, can be prevented if we can put more focus on awareness. Government, it definitely has an important responsibility around it, and I think they have done a wonderful work. If we can just pick up the model of how COVID-19 awareness was done, and as I said that initially we saw a lot of stigma around even the COVID patients. It was considered as a disease brought to India by riches, who flew in aircrafts and came to India and brought that disease. But over the period, people realized it, and I think the government put a lot of effort in making people aware that this is just a disease and it can impact anyone, and it is not your fault at this time. But there are ways to prevent it. Can there be the similar kind of efforts, concentrated efforts, as we have seen, or maybe part of it for many other diseases? And I think that they can do wonders.
Yes, definitely. I think there's really learnings on this from, as I said, pretty much all diseases, because we face some type of stigma or the other on pretty much all of them. Mental health has its own type of stigma. TB, because I have worked for several years on tuberculosis control in urban slums. And people would say that, I don't want to let anyone know that I have this disease, even though I would tell them repeatedly that it's perfectly treatable, it's perfectly curable. They would say, no, I'd rather die, but I don't want anyone to know I have this. So I think there's a lot that we've learned. The learnings are not just in the government. They are also in a lot of civil society organizations. They're in a lot of other development partners. So I think somewhere we need to bring all these lessons that we've learned now from COVID, as you mentioned. Again, here it's been a journey where there are certain things that have worked well. So we need to bring all those together. Of course, we'll need to look at certain unique aspects that cancer has as a disease, and certain unique challenges that come with it. But I think there's certainly a lot of learnings that we can pick up from diseases and we can bring to this. And as I said, we made a small start with some of these health and wellness centers, but there's a very long way to go in actually fully operationalizing them, fully making sure that they are getting the message out, they are encouraging people to come forward, be it for screening or be it to just get a checkup done. So I think there's definitely a long way to go in that. But directionally, I think it's good that we have made this start. I, at least just in the last several years that I have even worked in public health, I see a greater acknowledgement of how we need to focus on the non-communicable diseases, how we need to focus on cancers, how we need to emphasize the early detection, the early treatment. Because not only does it save more lives, it's also more cost efficient for the health system. You don't want to be treating everybody coming to you at an advanced stage. So I think gradually, as a lot of these things in the policy space can take a lot of time, and it's repeatedly putting out those messages. But gradually, I see some movement in the right direction. But we obviously have a very long way to go because we are such a large and diverse country. And as I said, that we don't live just in our metros, till we can reach the last person in the village, in the small town, we can't say our job is done.
Absolutely. Thank you so much, Urvasi ji. I think we absolutely have made very important points, and yes, we are moving towards the right direction. Maybe it's a time we think of setting up something like Department of Preventive and Promotive Health or something like this, which works more focused on this area, which can help people prevent many diseases. Thank you so much. There is somebody with us in this panel, Ms. Vandana Gupta from Mumbai, and she is a speaker in the next panel. But since she mentioned some very interesting aspects, and she is somebody who has seen a much more normalized aspect of, I think, going through something like lymphoma. She also had lymphoma, I think, almost 2 decades back. I would not say survivor, but she had, and she is now out of it. Ms. Vandana, would you like to open your video and share your thoughts? Vandana ji, yes, you are on mute. So since we had Mr. Basu, and we understand his point also, since you are working in the, I think, lymphoma awareness also for some time, tell us something about you. What was your experience? And
So now I would like to actually motivate Mr. Basu to be more open about his cancer. I had Hodgkin's 28 years back, and that time maybe the situations were even tougher. But it depends on how you take it. Because I would like to say from this medium that when people would come to me with the thing that they wanted me to cry, because that is what is the cultural aspect of our country. That if you go to visit a cancer patient, you must make that person cry and then your job is done. I would tell them that I don't want to talk to you unless you have had cancer. So, they knew that I was very bold and I didn't want to hear any nonsense from anybody. That was number one. Secondly was that, I went out whether when I was bald, when I was, whatever stage of the cancer disease I was in, I went out and I faced people, because I felt that if my family could see me like this every single day, every time, what is there to hide? Why should I not let everybody know that I'm going through it? And I'm stronger by going through it. So I let everybody know that I had cancer and I went out as much as possible and I spoke about it. I gave interviews, whether it was on television, radio, paper, anything or everything. That was number two. And the third is that, I started this organization, which is called We Care Foundation, with the aim of helping patients who came in to Bombay for treatment, with to provide them with as much information as they wanted and to empower them in every possible way. So I think, Mr. Basu, if you open up and if you become, like you begin to appreciate what you've got and what you can get and how you are a stronger person because you've had the strength to face the disease, you might be able to, stop all conversations and come out a more positive person and not let people, bog you down in your feelings. So especially Mr. Basu, and please pardon me if you feel offended, but I would like to really motivate you into this.
Thank you so much, Ms. Gupta. I think both aspects are, fine, but at the same time, what is more important is that more people need to know about the possibility of such diseases. Anyone can get it, so it has to be much more a normalized conversation for everyone. And yes, with the normalized conversation, I think we can also contribute to early detection of these diseases, because many times they are not diagnosed on time because we try to run away from them and do not go for the right kind of diagnosis, right kind of the consultation, which delays the overall treatment process. And at the same time, many places, because of the lack of healthcare or diagnosis facility, it happens. Dr. Shah, we have two patients with us who got lymphoma at their kind of adult age, but we also see that the lymphoma are impacting a lot of children as well. What is your view on that, and what is the prevalence of lymphoma among children? What kind of lymphomas are happening in among children, and what need to be done? What kind of symptoms parents should look for, or what is the way of screening it early? Dr. Shah. Dr. Shah, you are with us? Dr. Bhargava, would you like to, take this question?
Yes, I think there is no age. When we say it is increasing more in children, I would say there is no age to define it. Okay, it is approximately 1 in 1 lakh. You can get Hodgkin lymphoma in pediatric age group. You can get Burkitt's lymphoma in these age groups. You can get many more lymphomas. Even non-Hodgkin lymphomas are rare though in pediatric age group. The majority is Hodgkin lymphoma and then a Burkitt's lymphoma. There are different kinds of lymphomas. And again, the symptoms could be very vague: fever, weight loss, not able to eat, night sweats, bony pains, joint pains, abdominal pain, abdominal fullness. So all these symptoms are the great mimickers of various. So you see,
sir, your voice is not coming. You are on mute, sir. Sorry.
they can, sorry. So this lymphoma day, we should say every lymph node is not In India, still, when Dr. Urvashi speaking, Ms. Urvashi was speaking, I want to is not tuberculosis. That was 6 months of treatment of ATT, tuberculosis medications, where they were all lymphomas to begin with, because that's where the biopsy was never done. Because we never thought that cancer can come to us. From this podium, I would like to highlight there is no age, there is no karma, there is no caste, creed, or sex which will prevent you from not having a cancer. It is a natural process of evolution. It is like diabetes, hypertension. It is like mental health illnesses. It could be anything. And cancer is one of those diseases. So please, dear friends, understand cancer is just a disease. It's a problem which comes to you. You have a solution. Unlock it, solve it, move ahead, live your life. And you forget about those days. Look at Vandana ji. 28 years back she had, when we never had great diagnostics. We never had great treatment modalities, and she is surviving. Look at her confidence. That's what the lymphoma is all about. It's a conglomeration of many diseases. It's just not one disease. So have patience, have faith, and fear of unknown. On this podium, I will say the fear of unknown is whenever when we don't understand a thing, we always are afraid of. And when we have a disease where 70-80% people can be cured, repeatedly, this message has to go. If diagnosed early, people will be cured. If diagnosed early, people can be cured. There are many people who will come ahead for treatments. It should not happen a peanut size lymph node which starts at 1st of January and you reach to the hospital by 1st of April. By that time, it is a size of a pumpkin. You don't want that. Why? Because you are afraid of spending. I would say spend early so that you don't have to spend later a large amount of money. So that you don't have to go to a doctor later down the line. So those are the clear-cut messages in a public health where people has to be made accountable for their own health. It's not alone the government can ever do all the things, but the people have to be aware of their own health. They have to start taking their health in their own hands and start working on it.
Thank you so much, Dr. Bhargava. I think very important point you are making that, we should not associate cancer with any kind of age group, any kind of karma. Anyone can get it. And that is why what is under your control is to take the action on time. Try to prevent if they are preventable. But if you get it, you try to diagnose it early and start your treatment faster. Dr. Saab, Urvashi ji talked about that a lot of government schemes have started supporting cancer patients also, because many times, as Mr. Basu also said, and also this is not only about the urban city settings. The affordability of cancer care is really an issue, and that is why I think Dr. Bhargava is also saying that it is good to spend early rather than spending at later, because later you will be spending more, and at the same time you may not get that kind of outcome. What kind of support do you see that under Ayushman Bharat scheme or under other government's scheme, are people really able to get that kind of ever advancing medications which can help them come out of these diseases faster, better, and in a more effective manner? Dr. Shah.
Yes, I think I am also working at government institute, that is Gujarat Cancer Research Institute. And I think we Gujaratis are lucky to have very good government schemes, particularly Ayushman. Then we have school health program under which any treatment to up to 18 years of age, any cancer treatment is given free, including bone marrow transplant and anything. And there are no limit to under school health program.
Wow.
While Ayushman, there is a limit per person, it is 5 lakhs. It is not, initially it was for the family. Now it is per person 5 lakhs. But some of the cancer treatment are so expensive that none of the insurance, private insurance also can cover it, because some of the treatment are 3 lakhs, 5 lakhs per month, and it is to be taken till progression. But I think as far as lymphoma is concerned, wherever, particularly pediatric lymphoma, it's a curative disease. And so under school health program, it is can be treated totally free, including central venous access, transplant, as I told you, everything is included.
But
And
that is only possible in Gujarat.
Only Gujarat and only in government institutes.
Okay.
Otherwise, that such schemes, if are given to the corporate hospitals, there will be a lot of misuse also of same schemes. So in IHW also sometimes we see those things that patient is progressing after few cycles, and in spite of that, all the cycles which is possible are given to the patient. But still, IHW is working very well, and most of the curable malignancy are covered under it, and also transplant is also covered under it, but there is a limit of 5 lakhs. So I think most of the patients get benefit of the IHW. And Gujarat, there is also another scheme is a low income group, that is LIG. So under that scheme, patient has to pay 50% and rest of the money will be paid by the government. So that also covers many things. Then Indian Cancer Congress, ICC also gives around 5 lakhs to 7 lakhs rupees for the bone marrow transplant patient or any curable malignancy treatment. So there are various schemes, and most of the patients, if the disease is curable, it is covered under one or other scheme.
Thank you. Thank you, Dr. Shah. Mr. Basu, I would like to come to you. In states like Gujarat and also under Ayushman Bharat, government has made some provisions. Many times you are also able to kind of support treatments under the private insurance. What was the situation with you? Did you fund the treatments out of your?
So most of it, yeah. So most of the treatment was funded like by ourselves, but recently by the West Bengal government has also come up with a scheme like Ayushman Bharat. They name it differently. I don't remember the exact name. Where per family, it's government of West Bengal scheme. So they also have a 4 or 5 lakh kind of a compensation, and it covers all the cancers and everything. But that is 5 lakh rupees per family. Okay. So even transplant and few other things are already covered in it.
If I may ask, how much was the expenditure for the treatment expenses?
Around 15 lakh. Around 15 lakh.
And all paid out of pocket.
Yes.
And you are saying that your treatment mostly happened through the conventional chemotherapy.
Conventional chemotherapy, yes.
And it was not including the new immunotherapies or targeted therapies and all those advanced treatments.
No. It was traditional chemotherapy.
Okay. So do you feel that there should have been a better, did you feel that maybe a health insurance would have helped you, which you might have not taken, or it was not?
Yeah. So that was my thing, that I didn't have a health insurance at that point in time. But obviously if you have a health insurance that covers all these diseases, then obviously it will be helpful financially at least.
Did it lead to any financial problem at home, funding 15 lakh rupees for treatment?
We did no. So if we didn't face any financial problem as such, but we had to spend that money. So we didn't have to borrow it from anywhere. But we had money, so we spent that. But otherwise, spending 15 lakh rupees at one go, I mean, like for one particular disease, is not easy, right? So that thing is there.
Yeah,
but otherwise,
Thank you so much. I think very important point. Here, all the people who get these diseases cannot foot all the bills from their pocket. Definitely they need support, and especially when the treatment cost is increasing. Dr. Shah gave a good example of Gujarat, where at least under school programs they are covered and without any limit. Urvashi ji, would you like to mention something here? How it can be made more comprehensive? So we see Ayushman Bharat rolled out in multiple states now. It is leaving some of the states only. And some of the state governments have done wonderful work, like what Dr. Shah said. How we can make the overall health support system better, and it can cover better treatments, as Dr. Bhargava was saying, that the treatments is improving, new advanced treatments are coming, they can make people healthier faster. What is your point on it? Are we moving towards the scenario when Ayushman Bharat kind of schemes will cover this all?
Yeah, so I think I was alluding to all these points earlier also, that one is, implementation is always, in a country like India. So some state might be doing very well, others might be lagging behind. So that is something we constantly need to address with all our programs. I think that's something that applies, across the board. But in terms of the insurance, definitely that's what I was saying, that we need to look at what we are including in the packages. Of course, it needs to be, looked at from the feasibility point of view. There are many other considerations when we are doing all this, the costing and all of that. But we do need to see that we can actually get these treatments, which might be accessible right now to only, a small percentage of people, should actually eventually be accessible to the entire population. I mean, that certainly has to be a goal if we are talking of universal health coverage. Now, of course, how we do it, it can't be just the government. We do need the private sector. And that is why in Ayushman Bharat, we have a very big component of public-private partnerships. So the intent is not that the government alone will do it or can do it actually, but will at least partner with, private sector, that we are doing the right investments, especially in parts of the country which are very, very neglected, and these are large parts. So like I mentioned, our smaller cities or towns or rural areas, because in our larger metros we might see a lot of health facilities which can provide these services. Yes, the financial part could still be a drain on a particular household, but at least you have access to the services. In many villages, towns, smaller urban centers, you won't even have access to some of these services. You will have to travel you'll have to travel long distances at times to come and get these treatments. So we need to address both those parts, because you cannot just give someone an insurance cover and not actually address the service delivery part, and vice versa. So that is why it needs to be very comprehensively looked at. The other thing with Ayushman Bharat right now is that it is focused on the poorest, right? So the absolutely the bottom of the pyramid. And I think that's right. I mean, that's where we should start, undoubtedly. But there is also what we call in the insurance terminology a big missing middle in India. In India, it's not just the poorest, and then you straight away have people at right at the top. You have a big missing middle, people who also lack health insurance. These could be professionals, these could be people in different kind of professional activities who actually don't have a health insurance. So we have been constantly advocating that we need to eventually expand Ayushman Bharat to also cover some of these people, because they can equally be hit by a big, financial burden like this. So we need to undoubtedly expand the ambit of that. But even in its current form, we need to look at making its implementation much more stronger, looking at resolving, issues that we face at state levels, and looking at our packages constantly and revisiting, because we get a lot of feedback that the costing is not realistic or, something's not working. So we need to keep making those course corrections. That is also very important.
Thank you. That's wonderful to hear. I am sure that through your influence and your work within Niti Aayog also, you must be, kind of playing an instrumental, important role in making this happen, and I'm sure we will reach to that situation soon. So let me, thank you so much, all our speakers. We are running a little, out of our schedule. So I would like to conclude this. And what would be my message is that to fight cancer in all form of it, including lymphoma, we need to be rapid against, these diseases. We need to be rapid against cancers. And this rapid resolve that comprises of letters R, A, P, I, D shall expand as R for realization by all of us that cancer can happen to anyone. And that is why there should not be any stigma attached to it. We have to be having more normalized discourse around cancer. A, that exhort us to act now and go for screenings, watch out for symptoms, and consult a doctor on time. And P shall motivate us to practice healthy habits, good food, good sleep, good exercise, good lifestyle, away from tobacco or alcoholism. And I, in Rapids, shall encourage us to inform everyone around us to follow these steps and put up a collective fight against cancer and anything, everything around it, which make our patients or people, vulnerable to it. And the D, which is the final, word in the Rapid, is to propel us to defeat cancer and make everyone enjoy a long, happy, and productive life. So thank you so much, all our speakers, esteemed doctors, and also the people who had these diseases, but they fought, they are back to the normal life and they are living healthy. Thank you all of you for joining us. The next session, I hand over to my colleague and media personality, Ms. Anisha Nair Dhawan, to take the discourse on lymphoma prevention and awareness forward. Thank you so much.
Thank you very much.
Over to you, Anisha.
Thank you, Kamal, for taking us through this discussion. Cancer treatment, of course, is critical, and it is tough on families because of the cost. But many new ways are coming in for us to find innovative solutions to the costing part of cancer treatment. And there is an awareness that many cancer cases are coming up in developing countries. So let's hope we will have more affordable medicines also coming in to cater to this large population. Now, we've been talking about lymphoma this month, as September is observed as the blood cancer month, and lymphoma is seen as one of the blood cancers. We have understood the different nuances of lymphoma and are encouraged by statistics that the cure rate is fairly high. But this is largely possible through early detection and effective management of lymphoma. In this session, we will discuss addressing the challenges of lymphoma and the changing landscape of cancer management in India. We are going to be joined by leading experts in cancer and cancer care, survivors, and those who work with cancer patients in this session. So please welcome our esteemed speakers who are joining us now and will be joining us in a few minutes to throw light on this topic. We are very happy to welcome Dr. Neeraj Siddharathan, Clinical Professor, Department of Blood and Marrow Transplantation, Amrita Cardio-Oncology Clinic, Clinical Hematology and Stem Cell Transplantation, Amrita Institute of Medical Sciences. We also have with us Ms. Vandana Gupta, founder of VK Foundation. Ms. Vandana Gupta has done a lot of work with cancer patients. We'll also be joined by Dr. Jeena Bhattacharya, Professor, Head of Department Oncology, Guwahati Medical College and Hospital, Guwahati. We have Dr. Pawan Kumar Singh, Head Hemato-Oncology and Bone Marrow Transplant, Hemato-Oncology, Tennis Hospital, and Dr. V.K. Smriti, Medical Oncologist and Hematologist, Leelavati Hospital and Research Center. A warm welcome to our guests for joining us this afternoon. Thank you so much for being with us, Dr. Siddharathan and Vandana ma'am. First up, ma'am, let me ask you, what are the biggest challenges in treating lymphoma or blood cancer patients in our country?
Good evening, and thank you very much for inviting me. But I think this question should really be to the doctors, because they are the ones who would know better about the treatment of Hodgkin's or lymphomas. From my point of view, it would be really maybe the challenges that a patient faces while when the diagnosis has been done, how the diagnosis has been conveyed to the patient, what are the expenses that are expected, and how much does the patient know, how empowered does he feel after knowing the diagnosis. So from a patient's perspective, those are the important issues. But the treatment part, I think the doctors would be the best people to talk about.
Right. Vandana ma'am, I'll come back to you to find out how the patient feels once he's given this information. Let me ask the doctors first. Dr. Siddharathan, what would you say? What is the biggest challenge in treating lymphoma patients in our country? It is believed that lymphoma has a very good cure rate, but what applies in Western world cannot be direct copy pasted in our country altogether. So, what are the biggest challenges? So I'd request you, Dr. Neeraj, to please unmute yourself.
Good evening, everybody. Thank you, Anisha. Thank you for inviting me here. And I think lymphoma is one of the common blood cancers that we come across in clinical practice. And as you rightly mentioned, there are different challenges. It's a heterogeneous disease. And it is seen in different populations. It is seen right from children up to young adults, adolescents, young adults, older adults, and elderly people. So it is one disease which encompasses the entire womb to tomb, in different names. So you have Hodgkin's lymphoma, which is by and large the more curable type of the lymphomas, and you have the non-Hodgkin's lymphomas, which are probably a little different biologically. And among that, you have slow-growing lymphomas, you have fast-growing lymphomas, you have aggressive ones, non-aggressive ones. But I think most important thing is in our country, what I felt after being exposed to different settings in a couple of states is that the one big challenge is the patient not being able to reach the healthcare provider in appropriate time, and that is one of the biggest challenges that we have now good facility, I believe, for making diagnosis right in the West. We have facilities of the laboratories setups, the clinical facilities in tertiary centers are all improving every day. It is actually a revolution. We have good drugs, good infrastructure, and good diagnostic facilities, but we still don't have the community care. Where we don't have a primary care, secondary care, and a tertiary care referral in that fashion, where you have a family physician picking up the early stage of the disease and then referring to the oncologist. So that kind of an infrastructure is missing in our country. And I think we have many patients presenting to us quite late in the disease. So an early detection when they're present with symptoms like a small swelling or a fever or a weight loss, and those are probably the important symptoms that you start with. And then often at the stage where they reach us, especially if they are from villages, it will be quite late. I think that will be the number one challenge that I would
challenge. Right. So late detection of cancer is a challenge for nearly all types of cancers in our country. Dr. Pavan Kumar is also with us. Dr. Pavan Kumar, what is a big challenge that you see in lymphoma management in our country? Now, abroad, we've seen a very high cure rate because there is a lot of awareness. Now, Dr. Neeraj has told us that late presentation of cases is a problem, and he mentioned the lack of infrastructure, which is the tertiary and the secondary centers. I want to ask, what I have seen in the shows that I've done so far in lymphoma is that, even diagnosing it is tough. It gets delayed, and it's not necessarily the patient's fault because the symptoms are not specific. They are sometimes vague or lumps. If usually it's lumps that come up, and then they're the ones that are indicative of lymphoma. But TB may also have some lumps. So even if I go to a general practitioner or to my family doctor, there may be other lines of treatment that will be recommended to me. So we are trying to create an awareness so that everybody comes on board, and not just patients, even regular physicians would recommend, early screening and early testing. What are the challenges that you have seen?
Hi, hello. So the challenges, basically, first thing, as Dr. Neeraj has already mentioned. So first thing is that diagnosing the disease, especially lymphoma. And most of the time what we encounter is, when a patient presents with fever and lymphadenopathies, so usually they directly don't go to oncologist or hemato-oncologist. So first, initially they go to physician or maybe surgeon. And what they usually do is they sometimes go for FNAC, and then usually for lymphoma, proper characterization and diagnosis, FNAC would not suffice. So what is important is to go for biopsy, because biopsy is mandatory and it is very important. So with biopsy only we can diagnose lymphoma and properly characterize what type of lymphoma it is, and then only we can guide patients accordingly what type of therapy is there. So first thing is that I want to mention here is that biopsy is very important to diagnose lymphoma. So FNAC sometimes like solid cancer, if it is metastatic spread, so cancer somewhere else which has spread to lymph node. So that would be easy to, for that FNAC is okay. We can detect whether it is cancerous involvement of lymph node because of some, so not lymphoma, other cancers. The other thing, what is important is that, so still, if we see lymph nodes are there, so lymphoma is not the commonest diagnosis. The tuberculosis in our country is more commoner as compared to yeah. If it is TB, we'll be able to get to know by FNAC alone. But patient's profile, and if the very big nodes are there and patient is symptomatic for that, and sometimes we can predict that this could be lymphoma. And there are some other blood tests like serum LDH and other these tests are there by which we can able. So it's always better, even though if they have gone for FNAC and suspicion of lymphoma, so they should immediately go for biopsy and consult an oncologist or a hemato-oncologist to exactly know whether it is lymphoma or not. And if it is lymphoma, so then proper treatment is needed. Lymphoma, for that they should consult an oncologist or hemato-oncologist. Another important thing that surgery is not the treatment for lymphoma. Lymphoma is usually treated by chemotherapy and very effectively. Chemotherapy, or sometimes if it is B cells, then immunotherapy may be added. So chemoimmunotherapy is the treatment for most of the lymphomas. Very rarely, sometimes if the lymph node size is bigger, sometimes radiation also do play a role in the management of lymphoma, but not the primary. It will be added to the chemoimmunotherapy regime.
All right. Vandana ma'am, I want to come to you to understand the patient side of the story. Now, once you hear cancer, you get scared. Plus, when you hear that you have kind of a blood cancer, you're even doubly scared. Because many years ago, blood cancer was considered incurable, deadly, and people would think that blood flows all over your body, and now the cancer is going to be everywhere. So it's like a death sentence. What have you seen with people who have blood cancer? Have things changed over the years?
Let me start with from the beginning and taking Hodgkin's as an example. I was diagnosed with Hodgkin's 28 years back, and the doctor had just told me that you have Hodgkin's. I didn't know what Hodgkin's meant. And I mean, I'm educated, but I'm not educated in the medical field. So I don't know what Hodgkin's meant. And then he added that yours is stage 3B. So I had heard cancer has 4 stages. So I'm in the 3rd stage, which means I'm not going to be living for long, And what is Hodgkin's? I don't know. It could be anything in the body. So that is why I say that when a doctor is talking to a patient, they need to explain. They need to tell them that this is what it is, and what is Hodgkin's, what it means, whether it's in the nodes, whether it's in the bloodstream, what does stage 3 mean, and so that the patient takes the news in a more, in a more enlightened manner. Now, so that is the one thing that I really feel is a big challenge for the patient and the caregiver, because both my husband and I knew nothing about it till we went to, and that was the age of no Google, So we had to really look for a medical encyclopedia to understand what is Hodgkin's lymphoma. So if the doctor had helped us, we would be very much in a more comfortable situation. Now, as far as I know, blood cancer means that it's in your entire blood system. So which means that it is in your whole body, because the blood is flowing throughout the body, right? So presumably it's in a situation where every cell, everything is getting affected because of the cancer in the blood. So the doctors also need to explain this to the patients. I mean, most of the learnings that I've got is only after I started my organization, and the doctors at that time were willing to teach me, because then I could share with the patients, because we explained to the doctors that the patients want to know, and they were willing to teach us so that we could explain properly. So if the patient knows that this is the situation, and maybe, you know, that time the cure rate was only about 40% or 50% for blood cancers. But now it is a much higher cure rate. Like for children, it's about 80 to 90%. For adults also, the rate has gone up. But there's a difference between Hodgkin's, non-Hodgkin's, and blood cancers. So that has to be understood even while we are talking on shows like this, that we cannot confuse blood cancer to Hodgkin's or to non-Hodgkin's. So that is the difference.
Ma'am, you had Hodgkin's lymphoma, and Hodgkin's is believed to be more straightforward and easy to manage. Now, for patients with lymphoma, like the doctor was explaining, surgery is usually not an option, and they manage pretty well with chemotherapy and in some cases radiation. But both these treatments have significant side effects. So, as a patient, what was your life like?
So first, let me just add on, maybe the doctors here can correct me if I'm wrong, that, you know, I was fortunate that my spleen was not affected. Because if my spleen had been affected, then I would have had to go through a surgery, a splenectomy. That means the removal of the spleen would have had to be done. So even though I was in stage 3, it was not affected, but my chemotherapy was suggested to me. And I had all the side effects that you can think of chemotherapy. I used to have nausea. I lost all my hair. My nails turned black. I had, some sort of a tingling feeling in my extremities and all that. But again, you know, nothing was explained to me by the doctor. Everything came as a shock. Everything just kept happening, you know. And each time something would happen, I would have had to ask the doctor, and they said, "Yeah, this happens on Hodgkin's." So again, you know, you are not understanding from the patient's point of view that if you are empowering a patient with all the information and knowledge, then the patient will be able to handle the disease better. I used to have nausea because that time there was no anti-emetic which had started. This is 28 years back. You know, when I was having my chemotherapy, that's the time when trials for anti-emetic were starting. So all those issues were there. So what you hear about chemotherapy, the worst that you can think of, I have gone through it. But then I would have been happier if I had been explained everything. But it was nice that I could be positive and think of all the good things that I have enjoyed in life, and that if I came out of it, what were the good things that I would get to enjoy, and that is what kept me going. You know, so that is how it was. Fortunately, Fortunately or unfortunately, I was going to be put on a trial when they were just starting a trial whether chemotherapy and radiation is a good idea. But by then, 6 months of my chemotherapy had finished, and I had become a little more bold about things, and I refused to take radiation. And I said, I will not take it because, it's not like I don't have a headache and I don't take Saridon till I have a headache. So unless I have a problem, I don't want to take radiation. But I've seen patients undergoing radiation having a lot of problems. Again, one is because they have not been explained about it, and second, because of course, radiation is more local, you know, so it's in one place, and that is where the effects are going to be. But the doctor who was going to enroll me in the clinical trial, when I asked him what the effects of radiation would be, he said, I can't tell you that there will be no side effects. There will be, because you have multiple sites, and each side get affected. And so, you know, if it was near the throat, your voice could get affected. If it was near the lungs, your breathing could get affected, and all those things. So that way, I was taking a decision based on what I knew, you know.
Okay, all right. And that's a great thing that at least you've managed to get this much information about your own condition and what could be the different options. We also have Dr. Smriti with us. We were talking about the challenges of treating lymphoma patients in our country. The doctor spoke about the lack of infrastructure to diagnose patients early. And we have Ms. Vandana Gupta, who spoke about the doctors not explaining the disease properly to the patient, and hence the patient not being ready for, you know, what could lie ahead of them in the cancer treatment. Ma'am, in your mind, through the years, there have been improvement in treatment for lymphoma as well. Is now a ready vector available for all doctors so that diagnostic workup for lymphoma is straightforward and hence less time consuming?
So if you're asking me about first the challenges that we face in the diagnosis of lymphoma is that many times with the lymph nodes and the fever, it mimics tuberculosis. So when they go to their primary physician and they just do like an FNAC, not a proper biopsy of the lymph node, often they get misled to believe that this is tuberculosis. So quite a few months are lost in treating the patient with tuberculosis because that happens to be the commonest disease in our country as far as infections are concerned. So there is a delay in diagnosis mainly because of this overlap. Now coming to the second point, that you need, since lymphoma are of various subtypes. I mean, if you go into the new classification, there would be around 30 different types of lymphomas. And so you need a really trained pathologist who is abreast with what is happening and how the classifications are expanding and changing to actually diagnose the subtype of the lymphoma. And this is very important because the treatments are actually tailored to which type of lymphoma the patient has. So getting a good diagnosis from the pathologist is the key to the proper treatment of this disease, because many times it is a curable disease, but you can cure it if you are on the right track right from the beginning.
Right.
Third point comes about the staging of the disease. So we have absolutely laid down guidelines that what sort of staging should be done for the lymphomas. So whether it's Hodgkin's or non-Hodgkin's, for example, just to give a simple example, in Hodgkin's lymphomas, when we do a PET scan, many times doing a bone marrow test is not essential. So all these things, there are guidelines laid down and we have to follow those guidelines. So that is what is there about the diagnosis and the challenges that we face. And since the lymph nodes are not painful, so many times patients delay going to the doctors thinking that it's not causing pain, so why should I get it tested? So these are the challenges that we face as far as diagnosis is concerned.
So Dr. Smriti, this ready retina that I was referring to would make it more streamlined to diagnose lymphomas and the different subtypes in our country. You said you need a good pathologist. But for general practitioners, because initially, I don't walk up and go straight to an oncologist. I'll go to my regular doctor. So is this ready retina made available to all kind of physicians? Because oncologists know the job very well. But they'll get all the testing and the diagnosis and the treatment according to the pathology done when the time arrives. But the time is just too late because general practitioners have treated it otherwise, like you said, like most likely like a diagnosis. So is this ready retina being shared with everyone, all medical practitioners?
I mean, ready retina in the sense that, there are so many societies of the physicians and they often call the oncologists to give them talks and update them, like how to deal with lymphadenopathy, how to deal with fever which doesn't go away with regular medicine. So all these are being taught in CMEs, and the doctors, the primary physicians are being made aware of it. So they should also be aware that, there's nothing like a ready reckoner for everything. I mean, there are guidelines down and the physicians have to go and consult those guidelines. And as I said, there are so many educational activities are occurring where we are asked to give talks, like if you are faced with a patient of lymphadenopathy, that is the commonest presentation of a lymphoma. How do you deal with it? Or a fever which doesn't go away. How do you deal with that? So, I mean, these educational events are always happening.
All right. And that, of course, is a lot of ground covered. We are also trying to increase the awareness about lymphoma by talking about it. Dr. Neeraj, Dr. Smriti has raised a very critical point about finding the pathology of the subtype of lymphoma. How does this impact the treatment, and how does it impact the outcome for a patient?
Yeah, so as Dr. Smriti mentioned, as I alluded to in earlier, there are different types of lymphoma, and in pathology class, I mean, you have initially broadly lymphomas divided into Hodgkin type lymphoma and a non-Hodgkin type lymphoma. Then you have the non-Hodgkin type being divided into a B cell lymphoma and a T cell lymphoma. And then you have further subdivisions on the B cells. You may have some 15, 20 cells also. And now you have particular immunohistochemistries. There are different markers. You have particular antigens. The tumor expressed particular antigens which can be targeted for treatment. So there are like CD20, so there's a targeted treatment for that. Or it can tell you the prognosis. Sometimes you can tell how aggressive the tumor is multiplying. When the pathologist can tell you how aggressive the tumor is, which subtype of the tumor it is. So and with each of these, with each of these subtypes, your treatment. One is prognostication. You can tell the patient, which Mrs. Vandana Gupta was mentioning, when the doctors talk to the patient, what he or she can clearly explain to the patient what is the aggressiveness of this disease. Yeah, that is one thing the pathologist can tell us. Second is, what is the treatment regimen that you can use for this patient, which will be successful. So these two are very important things which come out of the pathology report.
All right. So the pathology, understanding the biology of the cancer is a very important part of the entire treatment plan. Dr. Smriti, I just wanted to find out from you, what are the challenges in the management of relapsed and refractory lymphomas? Because if they're aggressive, there is a chance it comes back. But how do you address these challenges? The question is for Dr. Smriti. I think Dr. Smriti is not with us, so I'll. Yeah. Yes, ma'am.
Yes.
Please go ahead.
So I'm sorry, I have my mask on, but nowadays in relapsed lymphomas we have chemotherapy, we have non-chemotherapeutic options as well, and there are a lot of new drugs. It depends on which lymphoma you're dealing with. So in that you have things like immunotherapy, you have other things like what are called as antibody drug conjugates. So all these new therapies are there, and then there are the CAR T cells. So the problem in India that we face is the cost of all these newer therapies in the relapse setting. And so with the result that because of the cost constraints, we often land up just giving chemotherapy, and if the patient can afford it, then going for a transplant, patient's own bone marrow, what's called as auto transplant. And there are only certain indications for where you have a donor as a sibling. So, these are the constraints that we have when we treat relapsed lymphoma in our setting. The availability of some of the newer therapies, especially related to the cost factor.
Right. Vandana ma'am, I want to understand from the patient's perspective. Dr. Smriti has laid out to us that some of the newer cancer treatments, which work really remarkably well in the West, with great outcomes for especially Hodgkin's lymphoma, are very expensive. You look at immunology or the targeted treatment. What was your experience like? Did you ever relapse? Did you ever have a relapse? And when you work with cancer patients, how do they work around the financing of cancer treatment? And then, ma'am, if you could unmute yourself.
Yeah. Finances for the patients is an extremely challenging issue. especially nowadays after the COVID period, because you will be surprised to know that almost, I would say, most of the trusts have closed down their offices because they do not have the funds to share with the cancer patients. So to think that, the common man can get immunotherapy or can get into any other CAR T cell therapy is still not available in India as far as I know. And the others are so expensive that it's not possible for most of the people. I would say only 1% or 2% of the people who are affected with lymphomas may be able to get into it. But however, having said that, I think, again, I'm not a doctor to comment on it, but I think the regular chemotherapy that is offered to the patients is fairly effective, and I think it works very well. But of course, in complicated cases or in relapses, they may need some other treatment. But I'm not sure how many people can really afford it, and or how many people would go for an immunotherapy as a first line of treatment.
Dr. Jeena Bhattacharya is also with us. Dr. Jeena, what do you think about costs when it comes to the newer types of treatment for lymphomas? Because like chemotherapy is covered in the government hospitals, even in Ayushman Bharat. Simple chemotherapy is given in. It works pretty well in most of the lymphomas, especially the Hodgkin types of lymphomas. But if a patient will have a better outcome and a better quality of life, with a little more advanced, more expensive treatment, what kind of financing structure could be created so that these newer medicines and advancements of medicines reach everyone? Because what's the point of advancement of medicine if it only benefits a handful and not the majority?
Hello everyone. Actually, I am very sorry that I could come and join in late. And your voice, because of network problem, the voice is in between cracking. So I do not know whether you are hearing me or not.
Ma'am, I can hear you, and I'll rephrase the question for you.
Yeah, please.
The question is basically on the advanced treatments for lymphomas, which are expensive, be it immunology or be it targeted treatment. What kind of financing models can be developed so that advances can be, spread out to all the masses and not just a handful of people who can afford it?
Yeah, see, actually, I work in a medical college, which is a government medical college. And so we get to see patients from all sections of the society, and most of the time it is mostly low economic strata patients, and in fact all patients do come to our center. What our patients are getting benefited is from the support that we are getting from NHM. NHM in Assam is has been giving the medicines free of cost for all our patients since 2009. It is a continuous process that has been that has been there from NHM Assam, and therefore we are getting the medicines free of cost for our patients in all the medical colleges of the state. That is one part that is only for our state. And besides that, we have financial assistance from center, from other projects, like, as you must be knowing, Atal Amrit and PMJY. And nowadays, from the investigation point of view, also we are getting support from there's a Rashtriya Bal, some scheme is going on for which our pediatric patient population are getting benefit in terms of diagnosis and in terms of treatment. And
so, ma'am, what kind of treatments? You said these medicines are free. What kind of these medicines are free? Are they chemotherapy drugs? Are they targeted drugs? Are they immunotherapy drugs?
Yes, all high-end molecules are given free of cost by NHM for our patients. You name it, like for lymphoma, you may be knowing that rituximab is one of the molecules which is commonly used for B-cell lymphomas, and that is there for our patients, available for our patients. Likewise, we have the other medicines like bendamustine and all the molecules that are needed for treatment is presently available. And from the diagnostic point of view, also we have at baseline the PET-CT is available. Of course, this is not free of cost, but this is available in our center. So therefore, it has become easier for us to treat our patients. But
Okay.
definitely there are challenges like, the patients, but because even though we have the molecules, we do not have the diagnostic facilities in place in the center. So for that, we have to outsource. And we are getting those patients who cannot afford, we are getting it done through Atal Amrit from PMJY and Rashtriya Bal Seva. And besides that, there are some NGOs which are coming forward for those patients who are not being affording. And for
Okay.
this, we are outsourcing this test. We have to have a bone marrow. I mean, we have to have your diagnosis, as Dr. Smruti ma'am has said, that we have to have lymphoma is such a heterogeneous disease. There's so many types and subtypes, and therefore we need to know exactly which type of lymphoma the patient is having, and accordingly the treatment will change. I mean, it will be different from the pediatric population,
Yes.
from the adult population, and from low-grade lymphoma to high-grade lymphoma, the treatment is different. And therefore, we have to decide, and diagnosis is very important at the point, at a time of diagnosis. And subsequently also, we have to do certain tests for monitoring and see the response assessment, interim response assessment, and whether the patient is responding, whether the patient is refractory. So all this is, we have to do continuous flow for till the treatment is over. Therefore, there are a lot of challenges. That is one diagnostic. Then we have challenges like patients awareness is not there. Patient is come to us late. So therefore, my appeal would be, when there is a symptom like fever, weight loss, we most of the time patients get treatment for tuberculosis, then they come to us. So these are the things
so
that
this is So this is what most doctors also brought up, but it's very heartening to know that in the state of Assam, we are seeing drugs, even the advanced treatments, drugs being given to patients, and that's very good to know. Dr. Pavan Kumar, for the larger population of the middle class, who may not be benefited by some of these government schemes, what do you make of the new immunology medicines? And do you think that these immunotherapies will now rewrite the prognosis of recurrent lymphoma and really drastically change the way treatment happens?
See, when we see the management of lymphoma, especially the CD20 positive B cell lymphomas, where and in most of the lymphomas, they are usually cured by initial first line of therapy. The problem comes when these patients relapse. So there comes the role of all these immunotherapy, CAR T cell, and other treatment options, which are obviously very costly, or as a salvage, because once the patient relapses, they need salvage regimen. So usually 2 to 3 cycles of high dose chemotherapy, and then they are usually taken up for autologous bone marrow transplant. So in these settings, yes, treatment is costly, and sometimes these immunotherapies, like if we talk about, say, inhibitors like nivolumab, pembrolizumab, all these are very costly treatments. So role of these treatment comes when the disease relapses multiple times, and so is with the CAR T cell therapy. So these are, yes, costly treatment, not everybody can afford, and CAR T cell is still not available in India. So for that, patient need, if they have enough money, they can travel abroad. But yeah, these are the limitations. But yes, not every patient needs this. So in lymphomas, we can say that depending on the stage and prognostic score, almost 80 to 90% of patients can get cured if they are properly treated initially. So they can, almost 80 to 90% of lymphomas, they get cured.
And get cured by the use of chemotherapy and regular drugs.
Yeah, detected early, proper treatment. So that's why awareness is very important. Awareness among the general public, general people, and awareness amongst the physicians who are dealing with it, because they are the initial point of contact when the patient comes with a lymph node enlargement. So they should properly diagnose early, suspect lymphoma, and refer them early to oncologist or hemato-oncologist so that they can be treated in a better way.
All right. Dr. Neeraj, does the nutrition status of patients impact their outcomes, especially those who have aggressive lymphoma?
Yeah, so that's a very very important aspect which we often overlook, I think. But yes, I believe it does impact the outcome, the nutritional aspects, especially, and that's what we have seen when patients go through the chemotherapy regimen. Some of them are very harsh, and you make them immunosuppressed with the chemotherapy that you're giving, and the disease itself is also causing an immunosuppression. And in such situations, we often overlook the importance of adequate nutrition also, because sometimes patients have mucositis, especially when they're going for heavy treatments like heavy chemotherapies, bone marrow transplants, etc. Some of them are not able to take oral food. Some of them have vomiting, and many studies have actually shown that the nutrition has, undernutrition has an adverse impact on the outcomes of patients being treated with hematological malignancies. So, but I must confess, this is one thing which we don't probably address enough, and it is the diet is one of the things which patients are always very much worried about. That's one question we often invariably get from every family: what can we eat and what can we not eat? So and we have also been, I think, guilty of being very strict on diet. There has been data from 1970s which said have to be very strict on diet. You should not eat anything other than a fully cooked food, but then things have changed, and evidences have also changed. Now it is generally believed that you don't have to practice a very strict diet, and actually that may be counterproductive. So what we do at our center, after looking into some evidence, is that we give a normal diet and a low glycemic index with less sugar, but they are allowed to eat a normal diet. We encourage them to eat orally, adequately. We get the support of a nutritionist. The nutrition department will help, and it is a normal diet. We just encourage them a normal.
How many stem cell transplants are you doing in Assam? And there's a big risk of complications because of allogenic stem cell transplantation to the receiver. So now there are therapies that help reduce the risk and these rejections from the recipient. So are you doing the rejection doesn't happen from the receiver?
We have not started as yet, but
okay.
We have. Yeah. And but we get our patients with very severe neutropenia, and patients do come to us with neutropenic sepsis, like patients that count go down to as low as less than 100, where due to chemotherapy and during this time, it is like taking care of a transplant patient only. So we have that facility, but transplantation as such we have not started as yet in our center.
All right. Now we're coming towards the close of the show, so I'm going to take some closing comments from all our panelists here. Vandana ma'am, let me start with you. Now you've heard the doctors say that straightforward treatments like chemotherapy have great impact and great outcomes for treating the mainly the Hodgkin type of lymphomas. Now the benefits that are existent under different schemes. Are patients availing all of them? You said that in the pandemic, many trusts are facing fund crunches. But in closing, for those who have lymphomas, we've seen your example, 30 years and still with us. Is there a lot of hope? Because worldwide, we've seen great advancement, great outcomes, and survival rate is very high. Do you think it's only a matter of time that the same is replicated in our country?
So let me tell you that I think, as I said, Ayushman Bharat has their own issues because the medicines have to be approved by them. And as far as I know, it is 5 lakhs for family. So I don't know how much can the family just spend on one person and not keep for the others. So that becomes a major challenge. The second big challenge is that, in all these new therapies that are there, all the immunotherapies and all the molecular therapies, as I know that most of the pharma companies have a program with it, which is called the patient assistant or patient access program, where the patient may have to buy one dose and may get 2 or 3 doses free or something like that, which can entitle them to get into the better quality drugs if there is a relapse. Now, the information for this is normally given by the doctor to the patient, or should be given by the doctor to the patient. But very often, because of the patient, doctors being busy, or like they are preoccupied or something like that, and this information is not shared with the patient, and then the patient begin to run helter skelter, knowing that there is a medicine which can help them, but they can't afford to buy. This has happened with me with a couple of patients, that the patients have called up. When we found out the company which was making the medicine, we called up the company, and then the company said, but there's an access program to it, which would cut down the cost of the medicine by almost 1/3, So I think if there is such program, then if it can be put in bold in a doctor's room to remind the patient about this program and to give them the name of the local representative, it would be a big help.
Yes, definitely. We should do all that everybody can do to make treatment accessible to one and all. Dr. Tina, what would you like to say to wrap up this discussion on all the challenges that you have seen in treatment lymphoma, and what do you see the road ahead like? Do you think it only gets better from here on?
See, actually, in what Vandana Gupta has mentioned just now, that that we should be, there are a lot of assistance program that is there from the different companies. And most of the companies nowadays, they have, even though we may not be using the original molecules, we have a lot of generic brands which are equally good for the patients, which are less costly. And there's a cap now. Previously, we have the problem. The Vandana Gupta must be knowing that there are certain molecules which are very costly. MRP was very high. But at the same time, if we get it directly from the company support, then it can go down to one. Sometimes in certain cases, it go down to 1/10 of the MRP. So this is how the challenges are there. In my center, yes, we have the molecules to be given free of cost. But there are centers outside my college, outside the center. There are challenges where we can help these patients through these programs. And the other challenge is the patient's awareness. When we start the treatment, as you know, there is dramatic relief of the symptoms. And then what they do not come back for the subsequent cycles on time. And that way the disease can become refractory, or they can have a relapse, early relapse. So this is where we get a lot of all of this thing who are involved in lymphoma care to create this awareness that they should come on time. And treatment luckily the treatment for lymphoma is only for a short duration, 6 months, maximum 6 months. Then maybe we can give maintenance for some patients, but mostly it is 6 months. So therefore, it is important that they should continue treatment and complete the course, and that will give them relief in majority of the time. So these are the challenges that we see, and I hope with the molecules that are coming in, there are a lot of development, revolution, I can say, in terms of treatment of lymphoma, all subtypes, and we have newer molecules coming up, and these are available now in India. Therefore, for refractory cases, also relapse cases, we have a lot of hope in near future.
All right, it sounds quite optimistic, and good to know that for lymphomas we'll have better outcomes with newer medicines being more accessible. Dr. Pavan Kumar, in conclusion, what would you like to say about the road ahead for lymphoma treatment in our country?
Yeah, so treatment, if we see if for a particular patient, so what are the options of treatment? So first thing is that those patients who are government beneficiaries like ECHS, CGHS, they can get all the treatment from with the government's help. And the second category of patient would be those who are having insurance. If they have medical insurance, then it can be covered. So I would recommend everybody should have at least their insurance, medical insurance. Who can afford the premium, they should go for it. And the other category of patients who can afford treatment, they don't have medical insurance, they are not having any government support, so they can get treatment in government hospital, very good. From government also, many centers are there which are offering treatment at affordable cost, so they can get there, and they can get government help also if they are. Now the problem comes when the majority of patients who do not have government support, who do not have medical insurance, what to do for them. So yeah, so they have the option of going. They don't have any option. They have to go for treatment at government hospital. And the treatment is there. Sometimes it is not effect. It is not if they are going early and they can get treatment. And there are other options also not very common in our country, like crowdfunding and all. So these are the options of treatments. But yes, majority of patients do not afford cancer treatment in our country. So we should try and focus on that. Initiative is there from the government also, from NGOs and other. And awareness is very important. So diagnosing early, treating properly, this is very important. Because if they are not treated in a proper way, ultimately they are going to get relapse, and that is difficult situation.
All right. So early treatment, awareness, and of course insurance, there will be a very important role in the management of lymphoma in our country in the years ahead. Dr. Neeraj, your concluding words on lymphoma. What do you think will be the road ahead for lymphoma patients in our country?
Yeah, so Anisha, I think I'll close with a few remarks from my side. So I think one is that we need to establish comprehensive care teams for the patients. In addition to the doctors, there are a lot of other people who the patient needs support from: nurses, clinical pharmacists, psychologists, and the other support staff needs to be there in any center. So the question that Mrs. Vandana Gupta madam was alluding to is that you don't have, a doctor cannot manage everything by himself. So there is need for a comprehensive care team at, for lymphoma care. The other thing is a support group, forming a support group from cancer survivors. So that's something which many developed countries are going that way. Disease-specific support groups and age-specific support groups. So they can actually contribute a lot to improving awareness among the patient community, especially those who are getting diagnosed within a 1 year of diagnosis. The support group can do a lot. Apart from financial support, I'm not talking about financial support, but emotional and psychological support that they can provide. A third thing is the category of patients who are not getting a medical insurance or
government support,
government insurance. So I think one area which is coming up is, we always tell them, don't sell your house and take treatment. Don't sell your house and take treatment. Absolutely. There are opportunities for fundraising or crowdfunding, and that has to be explored further. And the fourth point is, one of the things that we have right now, we have only approved treatments coming in, and that is already 5 years late. We don't have the latest treatment coming in, so we should
clinical trials. Yeah,
clinical trial, original research, which will make drugs cheaper, and clinical trials, the multicentric clinical trials, which should come, they are coming into the country. So I think we are hopeful that in the next 5 years, this scenario will definitely change. Effective treatments it's only going to improve. So I'm very hopeful.
Thank you. Thank you so much to all our speakers for joining us and sharing with us their views. After listening to all of you, even I'm very hopeful that treatment from here on for lymphoma patients is going to get better from here on. I'd like to thank Dr. Jeena Bhattacharya, Dr. Neeraj Siddharan, Dr. Pawan Kumar Singh, Dr. Smriti, and Dr. Vandana Gupta Thank you, Ms. Vandana Gupta. Thank you all for joining us this evening and sharing with us your experience, your views, your thoughts about lymphoma and its treatment in our country. Thank you all for joining us.
Thank you.
Thank you for the opportunity. Thank you.
Thank you all.
So we'll wrap up the lymphoma.